Assalamu alaikum. My name is Mohammad Ashar Khan. I am a physical therapist from Pakistan, and I'm going to talk about stroke because I recently got to treat a stroke patient. So I'm making this video to try to explain what stroke is and how we can try to avoid getting stroke and what can we do to treat it. So stroke, according to WHO, is defined as an accident to the brain with rapidly developing clinical signs of focal and global disturbance to cerebral function, with symptoms lasting 4 hours or longer or leading to death, with no apparent cause other than of vascular origin. So basically, stroke occurs due to vascular origin, meaning blood supply origin. So, and that stroke is, and stroke basically has two types, or these are also the causes of stroke, like ischemia. Ischemic stroke is due to interruption of blood flow to the various areas of the brain. And these are either due to atherosclerosis, due to hardening of the blood vessel, or due to a clot formation or thrombosis in the blood vessel that will disturb the flow of blood to the brain or the area of the brain. And then we have hemorrhagic stroke. The hemorrhagic stroke is less deadly as compared to, it's deadlier as well as ischemic stroke is, but the difference is that ischemic stroke occurs more commonly than hemorrhagic, because hemorrhagic stroke is basically the bursting of the blood vessel, meaning any type of acute trauma to the head will cause an artery to blow, to burst, or other than that, any type of infection that will lead to an artery getting swollen, aneurysm. So then you will have hemorrhagic stroke, which is least common. And then we have TIA. Now, TIA is transient ischemic attack. It's a temporarily blockage of blood flow to the brain, meaning the person, if getting a TIA stroke, then that means that he will recover after 3 to 4 days or after a week, but he will recover and he will not have as much severe damage to the brain done by any other by the other types of the stroke like ischemic or hemorrhagic. Those type of severe, and they damage the brain a lot. So these are the types and causes of the brain stroke. And so when we're talking about the arteries, where and how do the arteries come from and supply the brain? So the arteries that supply the brain come from an arch of aorta. Aorta is the biggest artery that supplies blood to the whole region of the body. So the arch of aorta gives two branches, carotid and vestibulovascular artery. So these two arteries go to the posterior segment of the neck, and they form a communication between them in a circular manner. That communication is called circle of Willis, and this communication give rise to three major arteries that supply blood to the brain or the areas of the brain: anterior cerebral artery, posterior cerebral artery, and middle cerebral artery. So the brain it has segments, it has lobes. The brain has a frontal lobe, which is forward. The brain has parietal lobe, which is superficial, which is superior. And the brain has temporal lobe, which is inferior. And the brain has an occipital lobe, which is posterior. So brain has four lobes, one anterior, one posterior, one superior, and one inferior. And the arteries, they supply uh, individually at various sites of the brain in these areas. So now we're going to talk about the symptoms of stroke. How do we diagnose if the person has stroke? To diagnose a person if he has stroke, the doctors ask for a diagnostic test like MRI or X-ray, and that test tells the doctor that a person is having a type of stroke, either ischemic or hemorrhagic, and how much extent of damage has been done by depletion of blood to the areas of the brain. So the symptoms of stroke are a person will not be able to see, he will have seeing problem, he will not be able to speak, he will not be able to describe his condition, he will feel weakness in his arm, leg, and face, he will feel pain, he will feel headache, he will feel vertigo. And these are the onset of of a stroke. If a person is having stroke, these are the symptoms that he will show. And now we have the risk factors. So the risk factors are those factors that will lead to the cause that will lead to stroke, because these factors will produce the cause meaning as in ischemic stroke or hemorrhagic stroke. So these factors are sedentary lifestyle, physical inactivity, being obese, over drinking, and using drugs. And if a person is hypertensive, if he has high cholesterol, if he is diabetic, and if he is having obstructive sleep apnea, which is basically a person who is snorting at night, meaning meaning that a person who has difficulty breathing at night. So that's basically obstructive sleep apnea. A person who snorts at night is that. And a person who has cardiac problems like heart defects and heart infection diseases, that sort of a person will has risk factors of having stroke. Other than that, a person who has a history, a lineage of an individual in his family having stroke, TIA, or heart defects, that such a person can also have a stroke. Nowadays, with COVID infection, you can get stroke. Factors are age, ethnicity, gender, and hormone. So, what are the medications a stroke person has to take? A stroke person has to take antiplatelets, anticoagulants, hypertension drugs, antidiabetic drugs, and painkillers, and in some cases, pregabalin and statins. So a person having stroke is solely dependent upon the artery that is either infarct or is either burst, hemorrhagic stroke. So if a person who has an anterior cerebral artery stroke, then the artery supplies the frontal lobe, and so the frontal lobe and the parietal lobe areas are supplied by anterior cerebral artery. So that means a person having this type of stroke will have hemiparesis. He will have sensory and motor loss in some areas of the body at one side of the brain. So if a person who has posterior cerebral artery stroke, he will only have vision loss because the posterior cerebral artery supplies only the occipital region, the posterior region of the brain. And if a person has middle cerebral artery stroke, which was the stroke in patient that I treated, also will have a lot of problems because this artery has central and peripheral branches. So it supplies a network of areas of the brain. So a lot of problems arise from this artery stroke. So basically, the stroke is dependent upon the extent of damage the brain has received from the depletion of blood supplied to it. So basically, the recovery time period is dependent upon the extent of damage. If the damage is more, then the recovery time will also be more. So now will we go to the treatment. What are the treatment procedures for stroke? If a person who has stroke, he will be given an IV injection of TPA, tissue plasminogen activator. Now, what does this injection does? That in cases like ischemic stroke, basically clot from if a clot is formed, this injection basically helps in dislodging the clot, removing the clot from the blood vessel. So it's a gold standard treatment process, and this injection, if given as early as possible, will show better results, and the damage to the brain will be minimized from it. If for some reason this injection is administered late and the damage has been done, then the patient will have to rely on the medications and as well as physical therapy. So what physical therapy do? So what physical therapy do is that it motivates the patient to try to move its areas that are immobilized, that are weak, that are limited, and try to make the patient feel as normal as he can about himself. While apparently that's not, because there are limitations because of the disease, but we have to create an environment so the patient can be productive. So what this does is that it motivates the patient, and the patient tries to use his brain more, and there are certain areas that can control the weakened or paralyzed part of the body. So physical therapy helps in stimulating the brain and trying it to move the body segments that have been damaged, that have been limited because of the damage to the brain. So this is my overview, or my brief overview of the stroke. If you took any literature or if you Google it, then you will see a very extensive explanation of what stroke is and how it is, and what's the brain and what are the arterial supply. And I would recommend that people should check it out and try to be more aware of it. It's a problem.